Hello, welcome to Jason Harding First Aid Training Tips. Today we're going to talk about burns. The four different categories of burn we've got. We've got a wet burn, which is hot water, hot fat, steam, anything like that. Dry burn, hot surface, friction, anything like that, cigarette end. Electrical burns. Now, electrical burns, be very aware that they are dangerous. Don't approach, don't try and help someone you think's been electrocuted until you know it's safe. And if we are talking high voltage, substations, that type of stuff, do not approach. Leave it to the professionals, even if you think it's safe, because electricity, high voltage, can arc through the air and cause serious injury. So stay away. Okay, and then we've got chemical burns, and I'll talk about chemical burns at the end. We've got one main job if we've got a burn, and that is to cool it down. As much cold water as we can, and for a wet, a dry, or an electrical burn, we need to be doing that for a minimum of 10 minutes. Okay, chemicals is slightly different. So, depth of burn. So we've got superficial, partial thickness, and full thickness, and that replaces the old first, second, and third degree. So superficial burn, common one, sunburn. Yeah, outer surface of skin, red, tender, no blistering, no open wounds, bit swollen maybe, tender to touch. Generally doesn't need any hospital treatment, but you might want to give some advice about keeping out the sun. Partial thickness burns are when we've got a blister, we've got an open wound, we've got weeping, we've got stickiness, and generally a lot more pain because we've opened the nerve endings, we've opened the blood vessels, and they're very tender to touch, very nasty and sticky and horrible. And then we've got a full thickness burn, and a full thickness burn is when the skin has gone. All right, it's completely burnt away. So, things like molten metal, high voltage electricity, them type of things, very, very nasty. Generally less painful because you actually burn the nerve endings away, but obviously very, very dangerous. Now, hospital treatment, we don't need it for superficial, like I said. Partial thickness, if it's on the face, the throat, the genitals, circumference of a hand, limb maybe, we should be thinking about some kind of hospital advice maybe, walk-in centre, that type of stuff. If it's a baby or a child, the size of the palm of the hand is the sort of gauge we go on. Sort of my hand, that big, baby's hand, that big. If it's bigger than that on that casualty, think about getting some hospital advice or taking to the walk-in, etc. All right. Any full thickness burn obviously needs hospital treatment. Okay. So, do's and don'ts then. We do cool it. Remember, we cool it for as much as minimum of 10 minutes with cold water, cold milk, cold anything. Not ice cold. Don't freeze it. You'll cause damage to the tissue. Cold shower, paddling pool, whatever you got to cool it for a minimum of 10 minutes. Remember that. Once you've cooled it, you can wrap it in a non-adhesive dressing. So, cling film is ideal. Plastic bags, that type of stuff. It stops infection getting in and hopefully gives a bit of comfort to your casualty. That takes us on to a don't. Don't wrap it in anything that's going to stick to it. Don't put a bandage on it. Don't stick a plaster on it that's going to stick, because when they come to remove it, obviously you're going to make an open wound. Do remove any clothing and jewellery that may be unaffected. So if I've got hot fat all down my shirt, I would cut it off and remove it. But if I found anything that was stuck to the body, I would leave it on. And that goes the same with jewellery. If it starts to peel the skin back, leave it where it is. Cool with it on. All right, let the professionals remove it later. So do not pop blisters. Whatever you do, whatever you've been told, do not pop blisters. That is an outer surface which is keeping infection out. So don't pop blisters. Don't wrap it, like I said, in anything sticky or adhesive. Don't remove any clothing or jewellery that's stuck to the wound. All right. And the other thing we need to talk about very quickly is chemical burns, especially to the face. We do that for a minimum of 20 minutes. Cool liquid as much as you can. But just be aware where the body is. So don't pour water because it's in this eye and then it's going to flood through to the other eye. So if we can lean them forward, always pour away from the good side. So it's dripping off, not dripping down the body, etc. Okay, now that's a very, very brief lesson on burns. If you want to know more, book yourself on a course at Jason Harding First Aid Training. Like and share this, please. Please get it out to lots of people. Because if we can stop scarring, we can stop damage to the lower tissues by simple things such as cooling it for a minimum of 10 minutes, 20 minutes for chemical. Thanks for watching. I'll see you again soon. See you later.